What is the cascade of care and how to do a cascade of care for kidney stones?
Yeah, thank you for that important question. So the cascade of care was popularized regarding HIV care. That's where the term came from. There are this many people with the infection. How many people are being treated? How many people have actually successfully had their viral loads lowered? Well, the data show that not many. Then they applied this concept to diabetes and showed again that many people with diabetes did not know they had diabetes, or if they knew it, they were not being treated adequately. So I heard these talks on this subject and read those papers and thought we could apply this as well to kidney stones, where again there's a well-known tendency for these patients to be lost to follow-up. Part of that, I think, is not recognizing that the kidney stones are a significant issue. So we need to tell people about that, about HIV, about diabetes, and about kidney stones as well. Kidney stones are connected to heart disease, high blood pressure, diabetes. And so I think part of the message is to keep people involved in their medical care by recognizing that kidney stones are not simply, I had a bad kidney stone last night, I had a funny episode, I'll tell you a great story. This is part of a systemic illness and has significant consequences.
And what are the impediments to care of patients with kidney stones?
I think part of what I'm saying is that sometimes it's not taken seriously, right? People tell a story and that's it. So that's one issue. I think that we as physicians need to explain to people that maybe your kidney stone is not the most important thing, but it's a marker for the fact that you're overweight, that your diet is not good, that your blood pressure is not controlled. And very often, as I've said, I've seen patients with kidney stones and pointed out to them that their health is altered in a variety of ways, and the kidney stone may be the least of it. May not be the most important part, but as an internist, I want to highlight the fact that this is connected to your risk of bone disease, blood pressure, heart disease.
And what is the role of general practitioners?
That's a very important idea, because I think if you look at the number of people at this meeting, it's relatively small. And this is a good number of the kidney stone specialists in Europe and in the United States. We know that there are primary care practitioners who do what I think are complex things, like manage atrial fibrillation or heart disease, diabetes. I think those are pretty complex, and yet many of those people never do anything about kidney stones and don't ever recognize that it's something that they need to be involved with in the care of their patients.